Hello friends, welcome to my channel Dentistry on Tips. Today we will be learning about the mnemonics which are of the subject oral pathology, which are very important for especially for long answer questions which are there in NEET MDS exams. It will save a lot of your time, so stay tuned. Today we will learn about Apert syndrome, Peri-Romberg syndrome, Golin-Gold syndrome, Men 1, Men 2, Men 3 syndrome, Beckett syndrome, and Peutz-Jeghers syndrome. Now, what is Apert syndrome? It is also called as acrocephalosyndactyly. It due to this early fusion of skull, hand, and feet occurs, and it is a genetic disorder. Now, in this picture, we can appreciate Apert syndrome. Here it is a small baby. He's having a cleft palate. His fingers are connected. So this is very important for this Apert syndrome. If you see the keyword connected fingers, then you can diagnose the syndrome very well. He has a flat beak nose, bulging downwards or slanting eyes. He has a high forehead that is tall and pointed head. It is also called as acrocephaly, and he is having open joints. And open joints are mainly seen in normal children. It allows the room for brain growth. Now, in this picture, connected fingers and cleft palate is very important. So, if you can appreciate these two keywords in your exam or any question, then you can diagnose Apert syndrome very well. So, the mnemonic for Apert syndrome is Apert's itself. Keep in mind it is also having s at the end, so keep in mind. A is for acrobrachycephaly, which we have seen in our last slide. It is also called as acrobrachycephaly. And P is for palatal cleft and prognathic mandible as well. E is for elongated eyes, which is also called as hypertelorism. So keep in mind, elongated eyes is also called as hypertelorism. R is for retrognathic mandible. It is also because of high arch of palate. You can appreciate a retrognathic mandible. He is having a tall forehead, syndactyly of hands and feet. So we will see our next slide. Now this is about Peri-Romberg syndrome. It is a rare syndrome. It also has facial hemiatrophy. It has a slowly progressive deterioration of skin, soft tissue, and half of the face, and it is usually in the left side. So remember this. And females are greatly affected as compared to men. Now we will see the mnemonic for Peri-Romberg syndrome. Peri-Romberg syndrome has a mnemonic facial. So remember, Peri-Romberg syndrome has a mnemonic facial. Facial is because of it is having a facial hemiatrophy, so that you can connect this to your mnemonic. So F is for facial hemiatrophy, which is very important. A is for and mainly for left half of the face, and A is for anhidrosis, inophthalmos, ptosis, meiosis. And this four of the points are of Horner syndrome. So I'll also in the next upcoming videos I'll be giving mnemonic for Horner sign itself. So stay tuned, guys. And C is for Kubdi Sabri. Kubdi Sabri is the indentation on the forehead of the patient. So I will I'll show you what is Kubdi Sabri in the next slide. I is for ipsilateral impairment of trigeminal distribution. A is for atrophy of mucosal oral mucosal membrane, upper lip, tongue, and it we can also appreciate delayed eruption, resorption, and reduced opening of the mouth. And L is for linear scleroderma. So in the next slide, I'll be showing you the photo of a patient who is having perirombic syndrome. See, now in this you can appreciate a facial hemiatrophy, and he has an indentation on the forehead, which is also called as Kubi Sabi. So, and obviously he'll be having impairment of trigeminal, ipsilateral impairment of trigeminal distribution. So you can link some of the points with the photos and remember them very nicely. Now we will be seeing about nevoid basal cell carcinoma, which is also called as Gorlin Gall syndrome. So these are my personal notes. So I'll be explaining you from this. In nevoid basal cell carcinoma, remember this boy. He's having and you remember him. This drawing you can draw and practice with yourself, and first you start from the head portion of the boy. Okay, so in the head he's having calcified flax cerebri, and ocular hypertelorism for the eyes. Ocular hypertelorism means he has his both the eyes are placed at a distance as compared to a normal individual. Okay, on his cheeks he's having multiple basal cell carcinoma, and it is the most common feature you can see or you can appreciate in nevoid basal cell carcinoma in the mid face region. Okay, so jaw cyst is also very important for nevoid basal cell carcinoma because it appears in 95% of the people, and most common jaw cyst is OKC, and it may be single or multiple cyst. So jaw cyst, you remember this is very important. Jaw cyst in 95% of the people, and it is mainly OKC. And next is on his hands he's having epidermal cyst. Okay, it is a skin finding. So in question they may ask about, they may give some keywords about skin finding, so keep in mind it is a epidermal cyst. And he's also having bifid rib, most commonly a skeletal abnormality which can be seen. And this year I have given neat MDS, and this question was asked of a bifid rib. Okay, so keep in mind it is very important. And on the palm he is having a palmar plantar, that are pits, and it is also very important because it occurs in 65 to 85% of people due to loculi impairment of mutation of basal epithelial cells. It occurs due to localized impairment of mutation of basal epithelial cell. Okay, and it is also autosomal dominant. So here you can appreciate sun here. So this patient should avoid sunlight. So keep in mind, keep in remember this also. And it is also, as I said, autosomal dominant because there is a PTCH mutation. He is also having, and in females you can appreciate calcified ovarian fibroma and kyphocoliosis, which are other skeleton abnormalities. And basal cell carcinoma is very important, which is triggered by UV light, so therefore avoid sunlight. Okay, and now in this, as a summarize, to summarize, I can say that if you don't remember all of the things, at least remember bifid rib, palmar plantar, jaw cyst, calcified falx cerebri is also very important. Ocular hypertelorism, it is also important. Basal cell carcinoma is also important. So now we will see men 1. Men 1. Now you can remember a man standing here, and he is having Imagine his two hands. In one hand he's having one pea, in second hand he's having second pea, and he's standing on a big pea. So remember, man one is having three peas. Okay, so first P is for pancreatic tumor. It is which is also called as insulinoma or gastrinoma. Obviously, because of pancreatic tumor, he can have insulinoma or gastrinoma. And another P is for pituitary tumors. It is adrenocorticoid tumors. It is also called as ACT. And another P is for parathyroid hyperplasia. So remember three P's, that is pituitary, pancreas, and parathyroid. From if in question, if there is a keyword adrenocortical tumors, so remember it is due to pituitary. It associates somehow with a pituitary. Okay, so thymic tumors, as a parathyroid, you can associate with parathyroid. Okay, so men 1 has 3p. Another is men 2. Men 2 is also called as men 2a. Remember this is very important. Men 2 is also called as men 2a, and men 3 is called as men 2b. Okay, so don't confuse in that. Men 3 is also called as men 2b. Okay, now this is men 2a. In men 2a, there are two men. Okay, name itself indicates two men. Okay, and he's having a p in between. Okay, so don't get confused with the p of men 1 and p of men 2. So remember this at least. In men 1 which p's are there, and in men 2 which p's are there. So it will be easy for remembering men 2p because it is having only one p. So p is parathyroid hyperplasia. And one men indicates pheochromocytoma. And medullary tumor for second men, which is very common. It is and men 2, it is also very important. Men 2 is also called as Sippel syndrome, and it occurs due to 634 mutation, exon 634 mutation. And this patients with men 2 also have a megacolon. Okay, so keep this in mind, remember this. And another one is men 3, which is also called as men 2b. Okay, now men 3 is also called as Gorlin syndrome. And now men 3 has three men. That is, first man has medullary thyroid carcinoma, second man has medulla of adrenal, that is adrenal medulla that is affected. It is also called as pheochromocytoma and tumor of adrenal medulla. Okay, and third man has mucosal neuroma. It also occurs due to exon 918 mutation. In the last slide, we have seen in men 2 it has 634 mutation, and in this is having 918 mutation. Men 2b is most aggressive. It has marfanoid features, and it has megacolon, medulated carcinoma of nerve fiber. Okay, so keep this in mind. Learn this or do anything, but it is very important. It is very important. I have made it as short as possible. So keep learning this and remember this. This is very important. Now, what is Beckett syndrome? Now, in Beckett syndrome is having many mnemonics. In this, you can appreciate three mnemonics. I'll explain it. So, first is Beckett syndrome, pink rose. P is for pathology test is positive. R is for recurrent genital ulceration. O is for oral ulceration, which is also recurrent. S is for skin lesion, and E is for eye lesion. For eye lesion, they can also use the words like iridocytitis or some words related to cornea. So in this you can appreciate a picture. In this a man or a boy you can appreciate is he's sitting on the stem of the tree, and he is trying to pluck the fruit which is hanging, and while plucking the fruit he sees a snake on another bark, and he's very fearful in that situation. So you can also imagine this thing. Now in this you can see he's sitting on a tree, okay, and he sees the snake, okay. So you can see, and with this picture you can also, another mnemonic is also can't see, can't pee, and can't poo, okay. So you can also appreciate this mnemonic: can't see, can't pee, and can't poo. And can't see means he's having eye lesions, can't pee means he's having genital lesions, and can't poo means he can't sit and he's having all the ulcers on his skin, okay. Then there is another mnemonic: don't prick me needle, I am already in pain. Okay, according this mnemonic, you can remember if you prick a needle, okay, in 24 to 48 hours you can see exaggerated inflammatory reaction on his hand or on his skin. So this mnemonic is also important. You can see, you can also remember this as don't prick me needle, I am already in pain, okay. And in Beckett syndrome incidence is male is more, that's why I have drawn a picture of a boy or a man. So remember this. And one more mnemonic is boy Beckett leaves at house HLAB51, okay. Now you can also remember this mnemonic: boy Beckett lives at a house HLAB51. In this gene HLAB51 is affected, and yes, you can see the house, and you can learn the mnemonic as well. So, in the next slide, we will see Peutz-Jeghers syndrome. It is very simple and it is very short, so it's easy to remember. Peutz means, you remember a pout. Pout means lips. Okay, by remembering this, you can also associate something with mouth, which has also oral mucosa and perioral skin. Means mouth is affected, oral mucosa and perioral skin is affected in Peutz-Jeghers syndrome. Peutz means pout, okay, or puke. By this Peutz, you can remember pout and puke. Puke means intestinal polyps. You can remember according to this. Jaegers, J for Jaegers, J for Jaguar. Jaguar has a spots on his skin, so you can remember pigmentation on the skin. Okay, so Peutz has pout, P for pout, and P for puke, J for Jaguar. If you remember this 2 to 3 times, you'll learn it very well. So, thank you guys. Now, another some, there are also a lot of syndromes and oral pathology synopsis. So in the next videos I'll be bringing you some of my notes, so it will help you somehow for your exam.